same row as us. We're gonna try this.
Okay, for this assessment, I need my pen light, a blanket, which the one that he is curled up with right now is the one that we are going to use. I have my stethoscope. I don't have a hammer, but I'm going to be using my stethoscope as my reflex hammer. Also, he has a positive COVID right now. He's positive for COVID, so that's why we're both wearing masks and I'm wearing my gloves to protect the both of us and to make sure that I don't get sick or whatever it may be. Just call her back later.
Yeah, that's right. Come on.
Hi, my name is Lauren. I'm a nursing student here at North Park University. How are you doing today?
Fine.
All right, I'm here to assess your head to toe assessment. It's going to take a few minutes. It shouldn't take too long. Is right now a good time?
Yep.
Okay, and can you go ahead and verify your name and date of birth for me, please?
Carrier ID 5991.
Okay, and do you have any allergies that I need to be aware of?
Nope.
All right, I just want to reassure you that anything you and I speak about today will be kept between me, you, and your healthcare team, okay?
Okay.
At this point, I would close all drapes, wash my hands, and clean my stethoscope and my pen light. So, we're going to get started, okay?
Okay.
So, while you're in a hospital, sometimes you can be a little confused. I ask my patients all of these questions. It's just a few questions to assess your orientation, okay? Can you tell me the date?
5/8/2020.
Okay, and who is the president?
Trump.
Okay, and do you know where you are?
My house.
Okay, so my patient is alert and oriented times 3. His speech is clear and coherent. It's not slowed. It's not rushed. His demeanor is calm. He's dressed appropriately for the season. You can't see, but he's wearing shorts and a shirt. So we're going to go ahead and get started, okay?
Okay.
All right, so go ahead and close your eyes for me. His eyelids are approximated when he closes his eyes. His eyelashes are evenly distributed on his eyelids as well. There is no exudate, there's no lumps, there's no bumps, there's no lesions, there's no edema that I can see. Go ahead and open your eyes. His pupils are equal, they are round. They're about a 4 to a 5. His eye color is like a greenish brown. His sclera is china white. I'm going to just touch your eyes, okay? That way you don't have to get up. His conjunctiva is pink. It is moist. There's no exudate, and I'm going to touch your lacrimal, okay? And there is no exudate in his lacrimal ducts, which is good. Next, what we're going to be doing is confrontation, okay?
Okay.
So go ahead and, do you remember this one?
Yep.
Okay. Let me know when you see.
Yep. Yep. Yep.
Okay.
Yep. Yep. Yes.
Okay, good. So my patient was able to see my fingers at the same time that I was, so his visual acuity is good. We're going to be doing the 6 cardinal points right now, okay? So go ahead, don't move your head, just follow with your eyes. Good, okay. My patient's eyes were able to move smoothly. There was no stuttering within his eye movements. Can you go ahead and put your hand right here? Next, I'm checking for pupillary light reflex. I'm looking in both eyes to make sure that his other eye is also accommodating. Good, okay. So his pupils were accommodating. They went from about a 4 to a 5 down to a 3. And next thing we're going to do, follow this down to your nose. Good. Okay, so we can say that my patient's pupils are equal, they're round, they're reactive to light, and they are accommodating. Next, what we're going to be doing is your temporal mandibular joint. So go ahead and open and close. Open one more time and close. And there's no crepitation. Did you have any pain when I was doing that? Okay, go ahead and smile for me. Frown. Squint your eyes as hard as you can. Open them as much as you can. And puff your cheeks. Good. Okay. The next one that we're going to do. Oh. Okay?
Yeah.
Alright, I'm going to be putting my hand against your cheek.
Okay.
Go ahead and push against it, okay? Okay. And push against. Good. Alright. So those cranial nerves are intact. I can't remember the numbers. I want to say it's 5 and 7. Next, I'm going to be checking for his lymph nodes. So you have pre-auricular, post-auricular, occipital, submental, you okay?
Mm-hmm.
Submandibular, jugulo-digastric, superficial cervical, deep cervical chain, and posterior cervical. And then go ahead and like shrug your shoulders and roll them forward. And supraclavicular. Good. And because we already tested his head and shoulder strength, we're not going to do that again. So, his torso is 2 to 1, which is normal. He's not using any accessory muscles to breathe. And we're going to go ahead and check his posterior lungs. Okay? You want to turn towards the camera? Okay. Let me know if I'm going to be going too fast or if you need to cough, okay?
Yeah.
Just take your time. There's no rush in this, okay?
What if we just put the stethoscope on the spot, because I'm going to a coughing fit if I'm taking deep breaths.
Okay. Okay, so three, 4, 5, 6. We'll do 7, 8, 9, 10. And I want to do just one more just to get some outside.
No, you can't come on. No, Maisie, you can't come on.
Good. I have been listening to his lung sounds all week. He does have adventitious lung sounds right now. There are some fine crackles and there's definite wheezing with him. Again, we didn't want to do the full breaths just because he would go into a coughing fit and it's really uncomfortable for him. His whole body goes into a spasm, so I hope you can understand. So go ahead and hold out your arms like you were flying a plane. Okay, and then we would do a deep breath and a deep breath and a deep breath and a deep breath. Okay, go ahead and turn. And we do 1, 2, 3, 4, 5, 6. Again, like I said, he would have wheezes and crackles. I don't want to make him uncomfortable right now or make him go into a spasm, so we're just not going to do it. So yeah. Next, I'm going to be checking your heart, okay?
Okay.
So I'm going to be checking for your radial pulses. And his radial pulses are equal bilateral. They're about a 2+, which is good. Go ahead and lay down for me. You okay?
Yep.
Sorry. Okay?
Yep. Just keep going.
Put your legs down as much as you can, though. Oh, wow, she's actually playing with the ball.
Oh, yeah.
So next I'm going to be checking for his apical pulse. So this is So apical pulse is fifth intercostal mid-clavicular, and it's going to be about a 2 to 3 inch, not inch, oh my gosh, 2 to 3 centimeter light tapping that I'll be feeling on my hand switch. Okay, where is, so that's 2, that's 3, that's 4, that's 5, and click again. All right, and I can't check for pulse deficit because I can check for pulse deficit, but I cannot check to see, I don't have a professor here with me. So what I'm going to be doing is listening to his heart. Oh, and my watch also broke this morning, so I'm using my wall clock right now. I'm easy, I know. Oh God.
Easy, come on.
Sweetheart.
Go on, go it up.
Good girl. Okay. There is no pulse deficit, which is good. His apical and his radial pulses are equal. Doing okay?
Yep.
Okay. Next, I'm going to be checking for his heart sounds. I'm going to be doing this with both my belt and my diaphragm. I'm going to be listening for any murmurs, any extra beats, any abnormalities that I might hear. And again, this is the 8-to-man, so it's going to be aortic, pulmonic, tricuspid, Erb's point, and then mitral. So we're going to do that 2 times through. Pulmonic, tricuspid, Erb's point, and mitral. I think that's actually the first time I've ever gotten it on one try without having to move my stethoscope around. And we're going to do it again, this time with my bell. Aortic, pulmonic, tricuspid, Erb's point, and mitral. Oh, that's so exciting. So his S1, S2 are normal. I don't hear any murmurs. I don't hear any extra heartbeats. I don't hear anything that's adventitious or anything that we need to be aware of. So what I'm going to do is I'm going to be listening to your mitral.
Okay.
You're going to go ahead and turn onto your left side and then start sitting up, okay?
Alright.
So just hang on. Okay, go ahead and turn to your left. Hang on, that's good. Okay, and then can you get up? Okay, and his heart, his beat did get a lot louder, which is to be expected, so that's good. Next I'm gonna check for his, I'm gonna look at his abdomen. I'm gonna keep his knees bent. You can go off.
No, keep going.
Okay. You can't see his abdomen unless his knees are flat, but I would have his knees flat. I would drape him if he didn't already have a drape on his legs. And do you mind if I lift up your shirt right
Go
now?
for it.
Okay. So, his abdomen is flat. It is soft. There are some freckles. There are no lumps. There are no bumps. There's no lesions. I don't see any peristaltic waves. I don't see, actually, an aortic pulsation. I don't see one. Hair distribution is from the bottom of his umbilicus to the top of his pant line, and his umbilicus is inverted. There's no lesions, there's no exudate coming from it, so it is normal. I'm going to be listening to some some bowel sounds right now, starting with his right lower quadrant. Bowel sounds always sound funky. His bowel sounds are hyperactive right now. Next I'm going to be doing some tympani. All 4 quadrants were tympanic, which is good. Next I'm going to be doing some light pushing here. Tell me if I'm hurting you in any way. Okay, and then I'm going to do some deep palpations. That hurt at all?
Oh.
Okay. Patient didn't have any guarding. I wasn't able to feel any lumps, bumps, or abnormalities, which is awesome. Last thing I'm going to do for his abdomen is check for liver. Just go ahead, kind of rest your arms just a little bit. Great. And take a deep breath. You okay? I wasn't able to palpate his liver, which is good, and he had no pain with it. Just coughing pain. Okay. After abdomen is musculoskeletal, I believe. Yeah. Hey, sweet girl. What's up? How are you? You just hanging out? Yeah, you just hanging out. You being a good girl? Are you being a good girl, huh? You okay?
Yeah.
Go ahead and
Go
sit
back
down.
to laying.
Huh?
Go back to laying.
No, just go ahead and sit up. I have a blanket. Nope. Okay, so next we're going to be doing a skin assessment. So his skin is warm, it is pink, it's not dry. I don't see any lumps, bumps, or lesions. There are some freckles that I know are distributed throughout his body. I'm going to be checking for skin turgor. Skin turgor is good. He does not have any tenting, so he is not dehydrated, which is awesome. I'm going to be checking on your hands. So I have your hands. Okay. She's going to suckle. So for his hands are consistent with the rest of his body, but his skin color is consistent with the rest of his body. They are warm. There's no edema, there's no erythema, there's no lumps, bumps, abnormalities. There's no obvious deformities. Does this hurt at all?
Nope.
Okay. His joint capsules are intact, and there's no pain with it as well, which is good. Contour is as expected. Real quick. Back to his overall skin assessment. I'm going to do his bony prominences real quick. There is no skin breakdown. Can't believe I forgot that one. On his knees, nothing. Good. And then, can you just hold it real quick for me? So on his bony prominences, there is no skin breakdown. Okay, back to his hands. Sorry. So again, his joint capsules are intact. There is no edema. There's no erythema. There's no redness. There's no swelling. His nail beds are smooth. There are no any markings on his nails that are abnormal. His nails are trimmed. They are rounded. There is no clubbing to his nails. And we're going to do capillary refill. on all of your fingers. And his capillary refill is brisk. It is less than 3, which is wonderful. And for range of motion, can you do this? Okay, and can you close and open? And then on a flat surface, can you just twist without moving your? Good. Okay, so patient has full range of motion in his hands. Next, we're going to be looking at your elbows. So again, contour is as expected. The skin color is consistent with the rest of his body. It is warm. There is no edema. There's no erythema. There's no redness. There's no swelling. There's no bony articulations that I can feel. His joint capsule is intact. I think that's it. For range of motion, can I have you bend and then extend and then again? Okay. And good. And he has equal strength bilaterally, and also his you okay?
Yeah, I was flexing.
Oh, thanks. His why?
Very cool.
Okay, that was funny. Don't make yourself laugh, that's what happens. His muscle tone is equal bilaterally as well. So onto his shoulders. His shoulders are warm. They're consistent with the rest of the body. The skin color is consistent with the rest of the body as well. There's no lumps, bumps, abnormalities. There's no lesions. There's no edema. There's no erythema. There's no swelling. Contour is as expected. There's no abnormalities, and there's no obvious deformities that I can see. So go ahead and can you do circles? Can you go like this? Down. And can you reach across your body? And then again. Okay. And then go against me. And then go, put him down. Push forward. Good. Patient has equal bilateral strength. Again, muscle tone is equal. Okay, go ahead and stand up for me. His hips, there's no obvious deformities, there's no bony articulations, there's no swelling, there's no erythema, there's no redness. In a hospital gown, this would be a lot easier, but temperature is consistent with the rest of the body, skin color is consistent with the rest of the body. There's no obvious deformities. No, go ahead and stand up. And can you lift your knee forward and down? And then same thing. And then can you lift it to the side? Okay, not that high. Just show me that you have range of motion. Good. And patient has full range of motion of his hips as well. Go ahead and sit down. I'm going to need your knees and your feet, so
Oh.
I'm sorry. You can go back to your isolation room in about 10 minutes. For the patient's knees, his muscle tone is equal bilaterally. He has no edema, no erythema, no redness, no swelling, no obvious abnormalities or deformities. There's no bony articulations. Contour is as expected. The warmth, the skin is warm, as with the rest of the body, and it is consistent with the rest of the body as well. Can you go ahead and kick one of your legs forward and back, and again, and back. Okay, and push. Good, and pull. Good, and again, equal bilateral strength within his knees, which is great. Okay, here we'll cover that. Can I have? Can I see your feet? Okay. Again, on his ankles, there's no obvious deformities or abnormalities, no bony articulations, there's no edema, there's no erythema as well on his legs using my 2 fingers. There's no edema that is present. Can you bend that at all? There we go. There's no lumps, there's no bumps, there's no lesions, there's no deformities. His joint capsules are intact. There's nothing that is, what's the word I'm looking for? Compensating them? His toenails are clean. They are cut. They are rounded. They are quit doing that. They are cut. They are rounded, and they are clean. Capillary refill on his toes is brisk. It is a 3+. Next, I'm going to be checking for his posterior tibialis pulse, which I hope they can see this. I am, if you can't see this, I am right here on both of his feet. They are equal bilaterally. They are 2+. Go ahead and bring it back up here. Next, I'm going to be checking for his dorsalis pedis, which again, they are equal bilaterally, and they are about a 2+. Good. We're almost done. We have 2 more things to do, okay?
Alright.
Okay, go ahead and, I would wash my hands, because, yeah, in the real world. Go ahead and look down. Next, I'm doing a cervical spine. C7 is a bony prominence right here. Color is consistent with the rest of his body. It is warm. There's no lumps, bumps, abnormalities. There's no lesions. There's no edema. There's no erythema. There's no redness. There's no swelling. Do you have any pain?
No.
Okay, good. Contour is as expected, and again, there's no obvious deformities that I can see. So go ahead and look high to the sky, chin to chest, ear to shoulder, and other shoulder. Good, the patient has full range of motion, which is wonderful. I'm trying to remember here. I'm going to sit back and expose your knees. Nope. Take your hands and go like this and pull. Yeah. We're going to see if we can do this. His feet are touching the floor. They're not dangling.
You hit it, I felt it, it just won't move.
Yeah, it just won't move. I thought I hit it on the first time. I'm usually really good at
You
this.
got it. Yep.
Good?
Good.
Yeah. I was able to get like all the reflexes in class. It was really fun.
I love playing with my reflexes.
Yeah, pretty fun, huh? Okay, we're almost done. I
Okay.
need you to stand up one more time and face the camera and go ahead and touch your toes.
Lose my drawers.
Okay, so patient's not cervical spine. Patient's spine is intact, it is straight. There are no signs of scoliosis that I do see. Skin color is consistent with the rest of the body. There's no warmth, there's no lumps, there's no bumps, there's no abnormalities that I can detect. So, yeah, go ahead and stand up. Go ahead and turn this way. Go ahead and close your eyes. Put your feet together and put your hands next to your body and close your eyes. This is a Romberg's test. Okay, good. Patient was not swaying. He did pass the Romberg's test, so that's good. And then just take a few steps and turn around and walk. Okay, you can tell the patient has absolutely no energy because COVID is totally wearing him out. Go ahead and sit down. Yeah. You okay?
Yeah, just cold.
Just cold?
Yep.
I think he's been cold for like the last week and a half, even when it was super warm outside. So that completes our test, your head to toe test. I'll give all of the results back to your doctor. We'll discuss it with him. Do you have any further questions for me? Is there anything I can get for you?
Close the door.
Close the door? Okay, I can close the door.
Thanks.
And yeah, that completes our assessment. I'm not going to hand him anything in this room because everything that he is touching goes into his isolation room with him. So he gets to touch nothing in here. Otherwise, I get to sterilize it. I put his bed back and low, and here's your imaginary call light. So, all right.
Yep.
Feel better, okay? I just shut the window.
Thanks.
And of course, as I'm exiting his room, I am washing my hands. Thank you for being a good patient.
Mm-hmm.